Resources.
Thank you very much, Mr. Speaker. And Mr. Speaker, where we are in a game sanctuary, if there is an allowable cut, it has to be licensed by the department. It has to be screened by the wildlife biologists to make sure it's appropriate, and the allotments are very conservative.
The honourable member for Kings West on your final supplementary.
With so much focus on our environment these days, it's obvious we must place more emphasis on protecting our forests and wooded areas. It's quite simple, Mr. Speaker. Having more trees is better for the environment. By allowing clear cutting in sanctuaries, we are contributing to everything from global warming to species extinction, not least to say that the Minister of Environment is waiting to get some help. Will you commit to stopping clear cutting within game sanctuaries within Nova Scotia?
The Honourable Minister of Natural Resources.
Yes, and thank you, Mr. Speaker. And Mr. Speaker, I really appreciate the member opposite bringing up the question of conservation and protection. Mr. Speaker, at the recent announcement with Bowater, the Premier referenced the 12%. The Minister of Environment has referenced 12% for protected wilderness areas and nature reserves. Mr. Speaker, this government is working towards that number, and indeed this past fiscal year, or the one that we are concluding on March the 31st, this province has invested a record $35 million in Crown land acquisitions.
The honourable member for Sackville-Cobequid.
Sole owner and operator of the Alma Garden Centre in Pictou County. On June 1st of last year, he injured his back at work, resulting in a herniated disc 5, Mr. Speaker. Mr. Patton has lived in constant pain since this injury. He has been on a wait list for surgery since September of 2006. Without this surgery, Mr. Patton cannot run his business. So I asked the Minister of Health, what is his department doing to help people like Mr. Patton who risk losing their business because they're waiting for surgery?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and it's I'm very sorry to hear about Mr. Patton's injury and the way that he is taking. Mr. Speaker, we know that we have a lot of work to do in wait times and trying to improve access for all Nova Scotians. Mr. Speaker, I know that we have been making some inroads in identifying what our wait times are, making sure that we're making strategic investments in more OR time and those kinds of things. But I know if the member opposite would want to bring the issue forward to me, I'd be happy to look into it for him.
The honourable member for Sackville-Cobequid on your first supplementary.
Thank you, Mr. Speaker. Because of Mr. Patton's level of pain, his doctor has prescribed him Dilaudid, a highly addictive pain medication which he has been taking regularly since June, Mr. Speaker. Not only is this medication highly addictive, but he also, because he's also a small business owner, Mr. Patton doesn't have a health plan, Mr. Speaker, and he pays for this himself. So I'd like to ask the Minister, why does his government expect people to spend their money on addictive drugs like Dilaudid without the surgery they need, because they need the surgery that they need, Mr. Speaker?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. And as I really don't know the full details of this situation, that I asked the member opposite maybe to bring that information to me. We could look into this a little further. I don't know if it's a scheduling problem with OR, if there's an issue with his surgeon, of why the wait is so long. Mr. Speaker, if we don't have the person to do the operation, there has to be something we can do for that patient to make them as comfortable as possible during their wait. So, Mr. Speaker, I know through a number of initiatives that we can try to increase our our work and make sure we make our wait times. Mr. Speaker, again, I offer my help in this one, if you can bring that information forward.
The honourable member for Sackville-Cobequid on your final supplementary.
I think it's important that the Minister realizes there's hundreds, if not thousands, of Nova Scotians across this province have a situation like Mr. Patton, and it's only saddens me, Mr. Speaker, that bringing it to the floor of the legislature seems to be the only access and the only attention that these patients get, Mr. Speaker.
The Honourable Minister of Health.
If they thought of picking up a phone and asking us about it, maybe we could help.
Hear, hear. Order, please. The time allotted for question period has expired. Government business. The Honourable Government House Leader.
Mr. Speaker, I move that you do now leave the chair and that the House resolve itself into the Committee of the Whole House on Supply.
Committee of House and Supply. The Honourable Member for Pictou East.
Thank you very much, Mr. Speaker. It's a great pleasure for me to rise in the House this afternoon and to have an allotment, I understand, of about 15 minutes. And in that 15 minutes, I want to talk about the constituency that I am so proud to represent, the constituency of Pictou East. Mr. Speaker, I believe that an average member of this House could do a Joseph Howe talk on Pictou East for 6 hours. But 15 minutes will have to suffice this afternoon because Pictou East is such a remarkable constituency. Pictou East contains one town, my hometown, the town of Westville. We call it friendly Westville. You cannot drive down the main street of Westville without almost everyone you meet with the hand coming up off the steering wheel to greet you. It is a friendly town. It is a town that this year will be celebrating 100 years of continuous July 1st celebrations. Now, a lot of towns, Mr. Speaker, a lot of communities across this country have had celebrations, but the celebrations have been on for a few years, off, and so on. But the town of Westville has consistently been there for 100 years of pride in this country. Pictou East is 3/4 rural, and these communities are spread out. They are a First Nation community at Pictou Landing. Fishing communities like Lismore, Mr. Speaker, a community with tremendous heart, a good fishing community, and we're happy to report to this House that there is some new life about to be breathed into that community. And we are looking at 50 jobs in relationship to a new development in that community. That, I believe, is good news for Pictou East. Mr. Speaker, we have an important forestry industry. We have an important farming industry. We used to be a mining area. We have many small and medium-sized businesses, and we are adjacent to ridings that have very large industries like Trenton Works, Michelin, Nina Paper. But in that constituency, we have coastal and inland communities that bring great pride to me as the member. Mr. Speaker, when I get up in the mornings, I can't wait to get up and do this job, and some mornings I almost pinch myself to make sure that this is real, that I am the member for Pictou East. And I hope, Mr. Speaker, to be pinching myself in 12 years' time in relationship to having this job and having the pride of representing Pictou East. We have Melmurby Beach, one of the greatest tourist attractions, and we have a tourist industry that is starting to heat up in places like the East River Valley. But I want to talk today about some of the pressing needs of Pictou East, some of the needs that I believe have to be met by this government. And number one on the list is that there is a facility, the Riverview Home, that is 100, actually it's 87 years old, but it was built in 1920. 1920. It's 87 years old. It's serving over 100 adult residential people in the community of Riverton. Now, the member for Pictou West and I went into that facility, and I'll try to give a little tour of that building. We started in the basement and ended up over a 3-hour period in the attic of that facility. And in the basement is the laundry and a lot of the maintenance and so on. Everyone in there, from a staff perspective, is doing a good job. You move upstairs and there's a kitchen that is in so desperate need of fundamental revamping. Throughout the entire structure, the wiring is in very poor condition. We have some old lifts to remove people from wheelchairs and into tubs and so on. Those lifts have actually come out of the Cole Harbour facility years and years ago. The walls have been scraped by wheelchairs, and the maintenance people keep trying to brighten them up and so on. But the most important, striking problem there is in relationship to the bedrooms in that facility. We have 2 people sharing 100 square feet. 100 square feet. We have 2 single beds and a little walk space. It is heart-wrenching to look into one of those rooms with the walls not even going up to the ceiling, to be able to hear any of the noises that are taking place on the entire floor, to see bureaus that are up against the bottom of a single bed that the bottom 2 drawers cannot open because the room is so tiny. You have to move the bureau out into the walk space to open those drawers. And despite this, the staff is working there with a great sense of responsibility, and they are trying to make that facility a facility of excellence. A facility of excellence. And this is what they have to work with. So I say to the Minister of Community Services, please look at this facility. Please address this problem. Please look at a facility that is 87 years old and in desperate shape. Now I want to move on to the roads of Pictou East, which is a concern to everyone. I see in the budget that there is $145 million that has been allocated. $145 million that has been allocated to highway construction. This at a time when the Nova Scotia Road Builders Association repeatedly says that we need $400 million to, over a series of years, bring our infrastructure up to something that is decent. And last year, Mr. Speaker, we heard that there was going to be the greatest road building budget and effort in decades. Well, Mr. Speaker, I say to you, Mr. Speaker, I say to you, looking at the roads that are existing in this province right now, I say that it was not the biggest road building in decades. I say it was the biggest spoof in a century. The biggest spoof in a century. Mr. Speaker, in relationship to tourism, we have what is called the East River Valley Community Development Association. And that association serves a very large rural area. And in that area, there is the historic swinging bridge over the one of the branches of the East River at Hopewell, something that we hope the Minister of Tourism will look after in making this a very historic recognition. that it will in fact be recognized as a historic facility. Now, we have some kiosks being built in that valley, tourist kiosks, and those tourist kiosks are going in 4 communities in the valley. And we have had some federal government support, and we have had some municipal government support, but I sure hope that the province will come up to the plate in relationship to some of the things that they're trying to do at this time in the East River Valley. Now, I want to address the situation involving internet services. And the government has been saying that there will be internet services at first 2010, now we're saying 2009 from the other side of the House. We have people and businesses that need to stay in these rural communities, and they can be assisted by staying with high-speed internet services. And every time the Minister of Economic Development is asked in relationship to high-speed internet, he says, we have a project on the go in Cumberland County. Well, my question is, how do we move beyond this little project that is on the go in Cumberland County? How do we, in fact, move beyond that? How do we look after other communities other than this small area that's being looked after? Now, every time I raise the issue of Barney's River or other areas in my constituency, I get the same response, and that we're doing some mapping, so on, and so on. Well, I've tried to do something before 2009, and I had the government services manager for Alliant come into that area and meet with the businesses, see what is actually in that community where over 100 people are employed by businesses in that rural area, including heavy trucking, lumbering, and so on. And Alliant is prepared to fund high-speed internet in that area, providing there is another partner, 1 or 2 more partners, monies will be forthcoming. And I'm saying, when we have done work to get an entity on side, where is the government to move beyond that situation in Cumberland County, a pilot project? Now, we're also trying to do something in another end of the riding. We have in Eureka a fire department that is putting a communications system on a high tower. And on that high tower, that company involved is prepared to service the area at $49 per person. So we're doing something on our own in that riding. Now, I want to deal quickly with environment. And I didn't realize my time was going so quickly, but the time does go by quickly here. We have a government that has suddenly become concerned about the environment. The environment has been our issue on this side of the House, in this party, for decades. But we have a government now that is trying to turn the Conservative blue by some kind of magic formula, as I mentioned the other night, you know, with a little dip, 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 and they're trying to turn this Conservative blue into a clean green. Well, I have several things in my riding that have to be addressed, and one is in relationship to independent monitoring on the Trenton generating Unit 5. We need independent monitoring on that. And we're looking for an independent monitoring set up by the Department of Environment at Greens Point. We're also trying to get a flow monitor on the East River, which is suffering tremendously with reduced flow. And in relationship to that, they're doing an extrapolation. This Department of Environment is doing an extrapolation on what happens on the Middle River and using it to determine the flows of the East River, which is total nonsense. In relationship to
Order,
health...
please. The honourable member's time has expired.
Thank
The honourable member for Preston.
Thank you, Mr. Speaker. It's a pleasure I rise to speak on supplies. A couple of issues I'm going to talk about today. And the first one is a badly needed complex in Lake Echo. In Lake Echo, we need a seniors complex. And last year, I got very, very hopeful. We had a local contractor that has the property. Decided to approach myself to see what kind of funding is available. And I know through the province and through CMHC, there's a program to build seniors complexes in the area. Now, the contractors pursued this, talked to the community, talked to seniors in the community, and there's definitely a need. Actually, it was quite an attractive building that was designed, and he went through the process, and at the end of it, it became so restrictive on the size of the building, what you could do with the building, and how you could do it. It wasn't acceptable to the seniors in the community, nor was it acceptable to the contractor. So therefore, the community doesn't have a badly needed facility. Now, the Lake Echo area was expanded many years ago. I believe it was in the 60s and early 70s that they expanded the area. A lot of housing was built there by the people that presently live here now in the community. And because of that timing, a lot of people now are getting ready for retirement. A lot of the seniors have lost their spouses, own homes, and simply can't afford to keep their homes and would rather be doing other things than looking after their lawns and maintaining their homes, and would like to travel and do all the things that seniors should do when they reach that age. So this complex is extremely important to our community. Now, there is no seniors complex in Lake Echo. Now, Lake Echo is the most densely populated area in my whole constituency. Now, in Preston, we have a beautiful seniors complex, Sarah Jane Clayton Manor, and the seniors are very happy there. And actually, I want to thank the government last year for installing a ventilation system that was badly needed. Actually, it was so badly needed in the hot weather, the fire alarm went off all the time. Because it was so hot and was on the second floor, it was impossible for people to stay there, although they had no choice. So I want to thank the government. When we brought it to their attention, they did act upon it. They did put the ventilation system in, and it has made a huge difference to the residents there. That unit is pretty well full, if not full at the present time. The next closest one we have is in Porters Lake, and that one is continually full with seldom any vacancies. So we have a large population of people in Lake Echo, seniors, that would move into the facility immediately, and I can't stress enough how badly it's needed. And not only that, there's quite a demographic age population in Lake Echo, and over the next probably 20 to 30 years, there's going to be seniors that will be available to go into a complex. Now, the seniors in Lake Echo are used to having their own homes and looking after their own properties, and have a lot of really nice homes, as is the same in all over my constituency. And they really would like to have a complex that reflects the community and really adds value to the community. And the developer, in this case, was very interested in doing that, interested in putting things in like a communal garden that people could go either for flowers or vegetables, whatever they want to do, and work on that. And unfortunately, this has not been able to go ahead so far. I say the land is there, the developer's there, the project is ready to go, but the restrictions that are put forward on what you're allowed to build, how you're allowed to build it, and all the other things that restricted this have actually stopped the project, and that's very unfortunate for all our residents. And I would encourage the government to look at this again to see if there's some way we can slacken off without diminishing the ability to meet the program, of course, but ease off some of the restrictions so this facility can be built and built immediately, and to make sure that the people in the community have the opportunity to retire and retire in comfort. The other issue I want to talk about today, and I'm glad to see the ministers here, to listen to this again. I was on to him many times, and I appreciate the work he's done so far on this, but until I get, or the community gets everything they want, we're not going to give up, so I'm going to tell you that right now. I want to talk about the Black Cultural Centre, and the centre that is the only place like it in Canada. It's the only facility that truly represents Black history and Black culture in this country. Now let me tell you what the government has done to the Black Cultural Centre, and they're very nice and polite people, and they won't come and fight for themselves, as I suggest they do all the time. So I've talked with them, and they've given me permission to discuss this in the legislature here and to work with the minister and the department to see if we can't get more funding. Well, since the Black Cultural Centre in the last 6-7 years since the present government took over, the funding of the Black Cultural Centre has been cut by some $60,000 a year. Now that may not seem like a lot of money, but when you've got a very small budget to start with, $60,000 is very substantial. As a result of that, they've had to reduce staff over the years. Their displays, a very difficult time getting displays they put in place because they simply don't have the resources. And worse comes to worse, I wrote to the Premier when we were trying to acquire this medal from for the Black Cultural Centre, the very historic thing from the construction platoon, and all the centre was looking for was to make up the shortfall from the fundraising they did to acquire this medal. And I got a reply back from the minister that the Premier that the minister would look into it. The minister sent me a letter and said we have no funding for that. We were talking probably $2,000 to $3,000, if that. Now this is an artifact of national significance. National significance. And the Black Cultural Centre did everything they possibly can to fundraise, and with the money they fundraised and with what hopefully the government could have put in, we could have guaranteed the medal would have been in the Black Cultural Centre, at least in Nova Scotia. And that brings another issue up. The Victoria Cross that's owned by the Black Cultural Centre, for the first Victoria Cross ever presented to a Canadian, to William Hall, it can't be stored in the Black Cultural Centre because they don't have the security facilities there to ensure it and to ensure that it's going to be safe. It's valued in well in excess of $1 million. They have other national and international treasures there that are priceless, absolutely priceless. They cannot put them on display, and they have to put them away in other areas where they're safe. Also, it's not an opportunity for them, for the Cultural Centre, to put on more displays about the important history and the local history of the Black community and the contribution, the fantastic contribution the Black community has made to all Nova Scotia, indeed all of Canada. I was at a very interesting luncheon a couple of weeks ago when people in the community, and this is recent history, talked about gathering, picking blueberries and walking or riding with a horse-drawn wagon into Halifax Market and selling blueberries so they could buy other things they needed. This was very, very important to the culture of the Black community, and especially in Preston, and it was a very interesting session to go through. It was a lot of pride. The people were telling how they did this, and a lot of fun they had, and the stories about seeing snakes and that some of them were afraid of, and a couple of instances where they ran into bears when they were doing this, but they had to go back. They had to go back and continue to go back, because if they didn't, they couldn't feed their family, couldn't look after their family. And it just shows you how resourceful the community has been and how wonderful, great things they have done with very little to work with. Now that's all changed today, and it's in some ways it's good, in some ways it's not. People pick blueberries now for the sake of enjoying the blueberries themselves, and a lot of things have changed, and we've got tremendous improvement in the community, and we see people going in and becoming, as I brought a motion the other day, the first captain in the Halifax Regional Firefighters from the Preston area and the African Nova Scotian community. And there's so many firsts going on today. I'll be glad when there's no more firsts and the Black community has set records in everything, and they can exceed and excel in everything they do, which they do. And in its pride, with pride, I represent the community, and the community is so special. When you're in the community, you're welcome into the homes, and the people are wonderful to deal with, and it's just a wonderful place to live and to work. Now, they've gone through a lot of things, but I can tell you, I've never seen anybody celebrate a graduation from a university or a high school like happens in East Preston, Cherrybrook, and in North Preston. They really now have a serious and a very much pride in the education that the young people are getting. They celebrate that. They bring them forward, and in North Preston in particular, it's a formal event where the young ladies and young men dress accordingly and are honored by the whole community. And I can tell you it's something to see. And if you've ever been to a church service in the black community, you understand what the rich cultural music is there. And if you haven't been, I would suggest anyone to go there that hasn't been there. It's an incredible experience. And you see the things that happen and the work and how history has changed and done things. You know, we've had the people come here, were brought here to build a citadel, some of the finest stonemasons in the world at that time. And that is still continuing today in the community. But again, I want to thank the government. This is one of the things that they've done to qualify the people in the community that are doing stonework, don't have the papers. And now there's a process in place, thanks to the Minister of Education and the government, that these people now can get their qualifications instead of making $7 an hour, to be able to make $25 or $30 an hour, join the unions and work, and imagine what difference that's going to make in families. People are doing the work already. And we've had some discussion from the other caucus over here that, which I took offense to and still take offense to, that they were dumbing down the requirements for people to go into this. Now, tradespeople to me are very intelligent people and hardworking people, and it takes a tremendous amount of experience to become a qualified and excellent stonemason or mechanic or whatever the case may be. So I want to give the government credit for that. I can't wait until that process is in place. I think it's been a little bit longer than I would hope that would happen. I know there's several people not only in the black community but in the white community as well in my area that will take advantage of this and become qualified tradespeople and indeed add more to our society and ultimately help their families so much with additional income they will get from that process. So there's a lot of good things happening. A lot of things have to change. A lot of things have to be improved. And we have to make sure that as we go through the process that we help people improve their lives, help people live safer, and the issues go on and on. I can talk in great length, and I don't have time today, about the safety issues and the crime that's been recently in my area, in the Preston area, which does not reflect the whole community. It's simply a small segment of the community, and it's unfortunate that these things happen. But they do happen, and we need support. We need a lot more help in the community, and one way to start this process is with the Black Cultural Center. If we can get proper funding, long-term funding, and the Black Cultural Center recognized as a provincial museum. They give it the rights there, make sure the employees are provincial civil servants, that they don't have to worry about that anymore, because these people have been working there a long time and actually have no pension plan because there's no money to do it. They don't have any benefits really that a civil servant would have, and all the other benefits that go with that. And then the funding to make sure we can put proper displays on, make sure the building is maintained properly, and to set this national treasure where it should be, in a place of prominence in Canada and in Nova Scotia. It's a fantastic tourist attraction. And the people that come and visit the Black Cultural Center, there was a lady there the other day, and there was a display of quilts that it was put on regarding the Underground Railway. And it's quite historic, and it tells the story of the quilt as you go through it. And they were actually used as part of the Underground Railway for directions how to find places and do things. And a lady came in from the U.S. and said, I want to buy that quilt. And the gentleman at the Black Cultural Center, Mr. Henry Bishop, says, well, I don't think it's for sale. She said, well, at any price? He said, well, I can try to find the owner and ask, but unfortunately couldn't find the owner that day. But that's how rich the culture is and how valued the work is from the community. So we really have to put forward, we have to ensure that this facility is protected, financed properly, and promoted properly, so it'll bring people into Nova Scotia. There's a lot of people in the community and outside the province and outside the country would love to go to this facility, spend an afternoon there, and hopefully hopefully go to a point and enjoy their visit, which I know they will. With that, I'd like to close the debate. Thank you.
Thank you. The motion is carried. Before we proceed to the debate and supply, just one item. When the member for Pictou East was speaking in debate, he did refer and utilize the word in reference to road construction program, that it was the word spoof, and on a more derogatory and or whimsical sense, it can be seen as satirical and or a parody, but it also can refer to a hoax, which has a different terminology. And I just would remind all members to be cognizant of parliamentary language. And I know that the honourable member in question probably did not intend that to be, but it can have a double meaning. So I just note that for our honourable colleagues, and we now go into supply.
The chair would now recognize the honourable member for Halifax Clayton Park to continue debate, and you have about 15 minutes.
Thank you very much, Mr. Chairman. I have a couple of questions I'd like to start off with, and I imagine I'll have to come back because I don't think 15 minutes is going to do it. But we know that the Health Minister will be with us for a number of hours yet. I'm sure you'll enjoy that. I wanted to start with some of the financials. I know there's a lot of issues around programs and the delivery of different programs in healthcare, but I'm interested in reading the budget bulletin where it refers to $140 million in extra spending and says that that's a 5% increase this year. At the same time, when we were studying the budget, we were given an increase of each of the departments, and it shows a 7% increase. I wonder if you could clarify the exact amount that the operating budget has gone up, operating in, I assume, I don't know if capital's in that. I think it's an operating budget. This particular one, which is net program expenses, shows it going from 2.76 billion to 2.9 billion, almost $3 billion. That's a 7% increase by my calculation, so I wonder if you could just refer to that.
The Honourable Minister of Health.
Thank you very much, Mr. Chair. Mr. Chair, it's good to be back for another 4 hours of estimates and debate the budget of the Department of Health. And to the member opposite, the member for Halifax Clayton Park, in regards to the increase, if we look at the total increase in dollar amount for the department, we're looking at that increase of I think it's $142 million increase, which represents 5%. The issue that we're showing is that 7% increase if you take out the revenue piece, and the revenue piece actually is held by the Department of Finance, and the Department of Finance would be showing that within their piece. And it is accounting rules that we have made some changes to, and I would probably ask you to maybe ask a few of those questions to the Minister of Finance when he has his opportunity here as well.
The honourable member for Halifax Clayton Park.
Thank you. Just as a clarification again, I still think it says this is net program expenses. So if it's net, it should already have taken out the additional revenue. Is that not right? It's not the gross expenses. It's netted against something, and I would say it's netted against your revenue. So I just want to clarify because I'm still not clear on it. Thank you.
The Honourable Minister of Health.
Thank you very much, Mr. Chair, and trying to get my accountant friend here to explain it a little more to me as well. Basically, if you look at the increase for this year, which represents the 7%, is $194.6 million. There are revenue generations within the department, and the department would generate somewhere near $48.6 million of revenue. That is taken out of our number, so it ends up showing the 146 million for our actual increase. So that 48.6 million is held for us centrally by the Department of Finance. So that's why we only reference the 5% increase in our total budget.
The honourable member for Halifax Clayton Park.
So if I understand the minister correctly, the 48.6 million would not be clear to anybody unless they spoke to the Minister of Finance and found that line item in his budget, somewhere in his budget, which I think is a little bit confusing, but I'm glad you clarified, because I used the figure in my reply to the budget speech that in fact it had gone up 7%, and I think we want to be talking the same language. The concern we have around the Department of Health is the rapid and dramatic increases year by year. A number of years that I've been here, it's been double digit, around 10%, 8%. In that range, so very, very high increases, and definitely higher than the increases we've seen in our economic growth and our revenue growth. So for all of us in the legislature, that is a concern, and I think it's important that we raise it again here and have that opportunity to, as the estimates continue, that we are looking at program delivery and how we can perhaps, make more efficiencies and save money. It's important that we do that in the context that we cannot continue this dramatic increase from year to year. And I know that the needs are acute, and that many people, need help. We heard today in question period about the wait times for oncology, and I don't believe people should have to wait 8 weeks for radiation if you have cancer. So, though, I understand, and the Deputy Minister is here today as well, I do understand the pressure that you're under with that. I wanted to speak a little bit, and I won't have time to go very far with this today, Mr. Chair. I'm not going to have too far to go, but I'd like to start on the links between health and economic development and ask the Minister about the doctor recruiting in the Yarmouth area. It was my understanding from a visit to the Regional Development Authority there that they have jointly gotten together, and it actually covers the Minister's riding as well, so he may be well familiar with this, but that the Regional Development Authority has stepped in to help in the recruitment of doctors, and in fact has helped to see that a clinic would be built and ready to go, basically a turnkey operation where all you need to do is have a doctor walk through the doors. And I believe that's very forward thinking. It's going outside the box and actually connecting the dots, which are that you can't have economic development in an area without the social and the necessary health infrastructure. And that is something that I thought was a very good move on their part and something we should celebrate. I wonder if you could tell me a little bit about it. Thank you.
The Honourable the Minister of Health.
Thank you very much, Mr. Chair, and thank you again to the member for Halifax Clayton Park for that question, and of course for some of those statements as well. Just to sort of start off where we were when we talked about the increases in healthcare budget, where we're talking about average increases over the last number of years, anywhere from 8 to 9%. From the last year, this will be one of the first years as we completed 05-06, where DHA budgets came within 1/20th of 1% on budget, which is the closest ever. I think DHAs have come to completely balancing since regionalization was changed into districts, and we've caught up and have a good feeling of what our budgeting process is. This year it looks like we're performing very well and coming into budget again. And the forecast for the Department of Health for one of the very first times in a very long time is on budget as well. The member also talked about the work that's being done in the Yarmouth County area in regards to doctor recruitment, working with a committee, and the committee is made up of course, the Regional Development Authority, the Southwest Shore Development Authority, with members of the local council, so Town of Yarmouth, Municipality of Yarmouth, and the Municipality of Argyll. They're working towards recruiting physicians. So they're actually taking some of their dollars and investing it in locating, going to different shows where we recruit our physicians, and also offering a fair incentive as well to attract doctors to the Yarmouth and surrounding area. I think really the success in this one is that You have your municipalities, your economic development, which is not just economic development, but community development, and I think we need to really focus in on there to look at our rural areas. But also physicians and some of the people from our hospital are actually on that committee as well. So, you know, you're using a whole bunch of I'm thinking French again, réseautage, so you're actually working with your contacts, and it's actually it showed us a fair amount of success. That if you look at district number 2, which is the Southwest, there have been 3 family practitioners recruited. There has been 2 specialists recruited, and then the CAP program for physicians, which is being run out of the Yarmouth site as well, has been doing. I think there's 5 going through the 5 or 4 going through the program, and 2 of them have actually stayed in the area as well. And that really is not even speaking to the proposed clinic that's being proposed for the south end of Yarmouth, converting the old liquor store into a clinic, and basically trying to build a clinic where, you know, there's a little more free flow of patients, building in a walk-in section of that, but trying to bring in the rest of those people in Southwest Nova Scotia that don't have a family physician today. So they are working on a whole bunch of levels in order to make this one work.
The honourable member for Halifax Clayton Park.
Could you tell me how much time I have left?
About 5 minutes.
Oh, very good. That's good. I wanted to know from the Minister of Health if he has been in any way involved in the issue around the proposed tire burning in the area of Brookfield. And only because there are a lot of health concerns that the individuals in that debate have had, and I know it's an economic development debate or perhaps a Department of Environment debate, but what we need to think of, and I'm sure the government is looking this way, I'm sure they're making these connections, that it's multi-departmental really, and the health concerns are based on air quality, and I think perhaps the Department of Health should be part of that debate.
The Honourable the Minister of Health.
Thank you very much, Mr. Chair, and to the member opposite. It is an issue that I am aware of, and is one that, as a cabinet member, that I'm aware of. But ultimately, at this point, you know, my concerns have been brought forward. But it is under the purview of the Minister of Environment and Labour, as well. I believe a little bit of work and input from the Department of HPP, so health promotion and protection from the public health standpoint. But at this point, you know, as we know from either questions in this House and other ones, that you know, there's no industrial permit at this point to burn tires at the Brookfield site, and I will let the process follow itself with the Department of Environment and Labour.
The honourable member for Halifax Clayton Park.
Thank you for that answer. I appreciate it. I wondered if you could tell me how many Nova Scotians do not have a physician, have not got a primary care physician. And it follows from the Yarmouth example. I understood last year there were 10,000 in Yarmouth, but they've made some real headway, as you mentioned, with the number of new physicians coming into that area. But do we have figures on how many people are just not, don't have an available physician?
The Honourable Minister of Health.
Thank you very much, Mr. Chair, and to the member from Halifax Clayton Park. We have actually the highest ratio of physicians to population in Canada. At this point, from our estimates, and I mean, you can always estimate of who doesn't have, there's really no system to collect that data, but from what we can understand at this point, we're short about 24 family practitioners, and we're short about 30 specialists. So what that exactly rolls into, how many patients or how many Nova Scotians don't have a physician, I don't know how the calculation could be done, but I know there's still a fair amount of people that do not have service, but we are making some good inroads on that.
The honourable member for Halifax Clayton Park.
Thank you, Mr. Chair. I am surprised that the Minister and the Deputy Minister don't have figures on the number of Nova Scotians that are not served by a doctor, because that's a very critical element to the cost of delivering health care. When you don't have a family physician, that's when you end up going directly to emergency rooms if anything should happen to you or your family. And we know that the emergency room stress is where a lot of the costs are coming from. The waits are unreasonable in emergency room, especially for the elderly that go there or for children that are lined up. But if you have a doctor or you have community health care, then that would obviously be your first point of contact, and you wouldn't be lining up at emergency rooms. So I wonder if the minister could let us know if there is a method or a means to capture this information, because I think it is something you should be tracking.
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And quickly is that, we do have a vacancy of physicians in the province. The problem we have now is that the model is changing all at the same time, where one physician is not replacing another physician, so we don't know exactly what the complement of a physician. So my example yesterday for the member from Clare, where their physician is actually quite sick at this point, so a lot of people are worrying. He used to see about 6,000 patients. It would take probably 2 or 2.5 new physicians in order to cover that same cover. So to make the calculation down, I think one physician would see about 3,000 or somewhere near 2,000 to 3,000 patients. So we could just work our numbers up from the 24 family practitioners missing and the special vacancies of 30, and we would work that one back.
Order, please. Time has expired for the honourable member's questioning, and I'll now recognize the honourable member for Sackville-Cobequid.
Thank you, Mr. Chairman, and welcome back, the Deputy Minister and staff and the Minister, to Health Estimates. Yesterday, when I was questioning the Minister, I was revolving around the physician recruitment and retention and emergency room closure. So I'd like to start off this afternoon with that area. One of the things that we've come forward with in supporting is the initiative around our medical students and the need to ensure that the medical students, especially at Dalhousie, remain here in the province. And I know that the University of Memorial University in Newfoundland does a great job at retaining a lot of their residents who go through medical school to stay and practice in Newfoundland. And the majority of Newfoundland is a rural province. And what they do is they have a portion of the education or their program that offers students and residents within the medical school rural visits or rural practicums, so that they can get out to the rural areas and look at what rural life is, what it has to offer, maybe entice them and encourage them to return to a rural community. So I know that in Dalhousie Medical School currently there's no, I don't believe, and maybe the Minister or the Deputy could inform the Minister on a program that would encourage, or part of their program that would encourage medical students here in our province to have those rural visits or the rural practicum aspect of their medical training here at the medical school at Dalhousie.
The Honourable the Minister of Health.
Thank you. There are a number of things going on at the same time when it comes to the retention of physicians, especially if we're talking about the new physicians that are graduating from Dalhousie, also working with those physicians that have had to go other places in order to receive their training, and trying to find ways to entice them back. At this point, there is a proposal going on at St. John for Dalhousie to provide a medical school in St. John. And what that would see is that over the next year, 2 years, you would see some of those people that are being trained in Halifax would be moving back to St. John. So we would open up about 10 seats here in Halifax, so that 10 more, in my estimation, 10 more Nova Scotians would be able to receive training at the local school. I know there's been some discussions, loan repayments and those types of things through the Department of Education, and we'll continue to provide that. The other thing that we really need to continue to look at is that we do provide those residency seats for those graduates, and we're actually going to start looking at those people that are getting trained outside, that we can give them a number of residency seats as well, so they can actually come back home, get the residencies, and hopefully keep them here to practice. But we still have to continue our discussion on return for service, where I would think that we would put some money into a program where a physician that gets trained here and will help them with their training here can give us a five-year plan, and then of course at the end hope that they of course fall in love with the community, or somebody else and get married and spend some time here. But ultimately, a lot of these things take time to set up, and we are in discussions right now with Dalhousie University on, of course, those spare 10 positions as they develop that program in St. John.
The honourable member for Sackville-Cobequid.
And as the minister's answer comes in, I have a bunch more questions, so hopefully I'll be able to get to all of them I remember. But I think it's imperative that the minister and his department recognize the importance of what the minister was stating around an agreement of service here in the province, because we don't have to look far. We go down the road here to the military, and recently in the papers, I don't know if the minister read around the success rate of the military on their initiative of attracting physicians to go into medical school, but to give, I believe it's a 5-year service to the Canadian military, and they've been very successful on increasing the number of physicians who are taking them up on that option, and I think the province, our province, needs to do that. I think it would be an important step to try to keep doctors here in Nova Scotia, and exactly what the minister said, we need to ensure that they start putting roots down in this province if they're not from here, that they may meet somebody to get married, have children, so that they enjoy the way of life here in the province, because we can't compete with Ontario and Alberta, the states, when it comes to the large incentives, especially cash incentives, that they offer medical students and residencies or those students ready to complete their studies at medical school. So I think it's important that we, government recognize that that's something we need to jump on, and I think it'll pay off dearly in the end. I know there's a cost, but I think that in return that some of our physicians will stay here and practice, especially in rural communities. Ironically, and maybe the minister knows this, I know it's a bit off that of topic, but he might not have the information, but he might, on the number of Nova Scotia residents that go to medical school here at Dalhousie. Would you have the number of Nova Scotians who attend? And I see there, so maybe I'll see if you have that answer to that question.
The Honourable Minister of Health.
Thank you very much. I'm not too sure on what the breakdown of the students are right now at the Dalhousie School. What I will do is endeavour to have those to you either today or tomorrow or Thursday during our estimates debate. Like I said, there's a couple of things going on in some negotiations that have been ongoing with Dalhousie University in respect to the positions that are there today, as well as those 10 positions that will be coming available to Nova Scotia students as they develop that program in St. John. The other things I think that's looking very promising as well is that we also fund or share the funding with 3 seats at Sherbrooke University for French medical school for those Acadians and Francophones that are interested in pursuing their education in the French language. There's also a proposal right now in New Brunswick for the development of a program at Moncton. And we're also looking we're actually in negotiations with them as well to see if we can and secure a few seats there as well. So, the issue of Francophone or Acadian doctors, I think we've had some really good retention rates with those folks where they are coming from our rural communities and Francophone communities, that they do want to go back and serve those communities in which brought them up. Also, before I sit down, I do want to table the information that was requested yesterday. I believe can't remember if it was the member for Sackville-Cobequid or the member for Glace Bay that had asked about health profession legislations that have not been proclaimed yet. We've been waiting for regulations and stuff. So I just wanted to table that, some information around the Dispensing Opticians Act, the Licensed Practical Nurses Act, Massage Therapy Act, and the Registered Nurses Act. So I just want to table that for the information of this House.
The Honourable Member for Sackville-Cobequid.
And I appreciate and look forward to the information the minister will try to provide, because I think it's important, not only for me and our caucus, but for the minister, for his staff, to be aware of what the stats are. And ironically, getting ready for estimates, it was easier for me to get some stats from Memorial University in the Faculty of Medicine than it was to get our own information. And for example, 40% of the population of students enrolled in the Faculty of Medicine at Memorial University come from rural areas of Newfoundland. So that brings me to my next question is, why don't we have designated seats in our medical school for rural students? And I think that is another area where we can try to capture those individuals, like Dr. Petrie, I believe, who just made an announcement recently, who is going to return to the Valley, I believe, after residency. I mean, that is a prime example of hopefully we can entice some of those rural residents, especially the young residents, to attend medical school, and then hopefully return to rural areas of this province. So I'll ask the minister that. Why don't we have rural designated seats in our medical school here in the province of Nova Scotia?
The Honourable Minister of Health.
Thank you, Mr. Chair. And Mr. Chair, this has been, I think, a basic ongoing discussion with Dalhousie University. I do want to, thank during these estimates the work of that school and, of course, of its dean, Harold Cook, who does a phenomenal job in making sure that we have probably one of the best schools in North America. But at the same time, a lot of their admission policies we feel have been excluding some Nova Scotians who we feel should be going through medical school who are from rural areas, but they have a very open policy where through test scoring that they admit, of course, those students who rate the highest. So there's always been a bit of a discussion on actual designated seats. Even though I mentioned those 10 seats of New Brunswick, at this point, it's been not necessarily a written rule or written policy of the admission policy that New Brunswick students would have these seats. It's just thankfully worked out that well for them that they have been able to have those seats and actually have them funded from the government of New Brunswick. So as we roll around, I would really like to continue my negotiations with Dalhousie and really the crux of our negotiations with those 10 seats that are going to be coming available, that we would want to put some conditions around those 10 seats to ensure that they are Nova Scotians and in my estimation, Nova Scotians from maybe some more rural settings. I don't know exactly how you would do that to make sure that you're not really impeding on somebody else's right for those seats. But ultimately, we would feel very important to get those Nova Scotians from rural areas or from Nova Scotia that have an attachment here. And it is our estimation, just like Dr. Petrie made the decision to provide medical oncology to Kentville, that this would follow through with other physicians as they graduate from that program.
The Honourable Member for Sackville-Cobequid.
And I know, Mr. Minister, through Chairman, that I've written many letters to the Minister over the last year and a half, and especially over the last several months. And one of the replies I received, and it was concerning retention and recruitment of physicians, especially in rural communities. And in the response, one of the letters you sent back to me, I believe in February of this year, was around the current master agreement with the physicians, and that it expires at the end of, in 4 days, I believe. So I'm wondering if that has been settled and that there's either an extension or is there a new agreement signed here in the province around the master agreement with the classification of emergency room physicians and the parameters that they work in.
The Honourable Minister of Health.
Thank you very much, Mr. Chair. I just wanted to maybe quickly talk about the master agreement, of course, with physicians. That is, I believe it, and the deputy is just checking that out as well, that agreement comes to, I believe, next April. But I think what we've talked about is that we're preparing now in discussions with Doctors Nova Scotia on what the new master agreement is going to look like. And I think over the last year and a half, 2 years, we've been working quite diligently with different units through our healthcare system, whether they be anesthesiologists, whether they be different professionals, and designing academic funding plans where there's a sharing and a recognition of the work that they do in research and in training, as well as the services that they provide to patients. There's also been a sort of reiteration of that programming as well, where we can have what's called an alternate funding plan, where the physician basically forgoes the issue of fee-for-service, but is duly compensated through this funding plan, where that funding plan is built on what they feel it will be the people they will see, other services that they provide, looking at the overheads of what their practice would cost them, and plus a bonus for other works that we would feel are necessary in the region that physician serves. The information that we have here, that another $22 million is being spent on doctors in the province, so that would be the redoing of some AFPs and APPs, and as well as preparing for our renegotiation of the master agreement with those physicians.
The honourable member for Sackville-Cobequid.
And just to go back to that, I think the minister just said that the agreement you believe is next year, but in your letter that you sent back, in here it says, and I quote, the current master agreement, which expires March 31st, 2007, and then you go on just to say that you were working with Doctors Nova Scotia to hopefully look at the classification and parameters, and it was around funding, especially around Cumberland County hospitals and the physicians and some of their issues in that. So maybe I'll just for clarification, is the current master agreement expiring this year at the end of this month, or is it next year?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. Mr. Chair, what we'll do is, just confirm the date with staff to make sure that we have the right one. I know the deputy feels that it's probably not to 2008. I know the document that maybe you have there talks about 2007. We do have a number of AFPs that are coming due at the end of this month, but I don't know if the master agreement is not. But I will provide that information for you. But sort of on the broader issue, we have a lot of physicians providing some wonderful service in many areas of this province, but we still continue to see ER closures and those kinds of things. And really what we need to do through discussions with Docs Nova Scotia is looking at the other services that we might be able to have provided by physicians and other pieces of work, whether it be inpatient work at a hospital, whether it be maybe some emergency coverage on an occasional basis, and those kind of things. And that really has to be a big part of the next negotiation of the master agreement.
The honourable member for Sackville-Cobequid.
Okay, thank you, Minister. I appreciate you trying to get that information. So now I'd like to go in the area of cancer care, and I know that the leader of the opposition in his questioning asked some questions around the colorectal screening program. So I'm not going to spend a lot of time on that, even though I think it's vital, it's important, and it was a choice and a commitment from your government back in the prior to the last election. And ironically, today I received word that the province of Alberta on the 23rd of this month just announced that they'll have a province-wide colorectal screening program, because they know, and I know the minister, and I hope he knows, and his department knows, the importance of it and the potential, the great potential, I think, on catching those individuals who might have prostate cancer and treating them early and being successful. As my colleague said earlier, I think it's 90% of those with colon cancer are curable. So it's a huge savings on our healthcare budget and on healthcare spending in this province. And I know the ministers, and he'll probably say it again, that they're putting forward $300,000. But when you made that commitment, and you were Minister of Health prior to the last election, when you made that commitment, was it your intention to try to implement a province-wide screening program as quickly as you can? Or when did you realize that you couldn't follow through on that commitment and that promise to provide that program here in the province?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. Just to follow up on the information of the previous question in regards to the expiry of the master agreement with physicians, that will expire March 31st, 2008, which we are preparing for that one. So I need to correct my letter. So if you bring it over here, I'll cross it off and maybe initial it just to be sure. But there are a number of AFPs that are coming due at the end of this month that we have to continue to negotiate. If we go to the colorectal screening program, and you know, back in the spring, we asked Cancer Care Nova Scotia to develop some recommendations on what a colorectal or a population-based colorectal screening program would look like. And that report was available to us somewhere near the end of November into December, where we've had a few months to look at those recommendations, come up with a few ideas on how we want to go forward with this program. I'm very happy that we've been able to fund it in budget 2007-2008. You know, there is still a lot of work to be done to ensure that we have the right program and have it available to Nova Scotians as soon as possible. You know, I wish that there was a way to develop programs or take programs and turn them on the next day you announce them. But the reality is that we don't have necessarily all the capacity that's required in the province today. We don't have exactly all the specialists that are required. So at the same time we're developing a screening program, we also have to develop the components in it to treat those individuals who will be unlucky enough to be diagnosed with cancer. But Mr. Chair, I can also say that we've been doing a lot of other things at the same time when it comes to cancer care in this province. You know, the recent announcement of the expansion of the medical oncology satellite clinics in the province, and the addition of one at the Kentville Hospital. The announcement yesterday of more funding for radiation oncology. You know, and now the announcement of the colorectal screening program. So we are doing a lot of things that all tie together into Cancer Care in Nova Scotia. The colorectal screening program, as I responded to the Leader of the Opposition during questioning yesterday, is that we need to have the pieces in place. We need to have the human resources available, because of course we're criticized on that every day as well. So I don't want to set up a program that we're not ready for. And I think it's going to take the better part of this year, the investment of $300,000 to get that program up and running and being able to see patients as soon as possible.
The Honourable Member for Sackville-Cobequid.
So going from colorectal colon cancer to breast cancer, and some questions around that. I know that Teresa Foley is the manager of the Nova Scotia Breast Screening Program, and she sent out a news release back in the beginning of the year, January 9th of this year, and I'll quote her here. She says, "We're a victim of our own success," end quote. And I would have to agree, because there's been a lot of education, a lot of awareness around breast cancer and the need for screening and for women in Nova Scotia to have mammograms and go through that process. And you know, Nova Scotians understand that and have done that. So one of the things that the implications with, you know, the knowledge of or educating Nova Scotians on hopefully screening and obtaining these tests is that the wait times for mammograms are growing every day here in this province. And I believe on the website for Capital Health, it's nearly 300 days for a mammogram to be done once it's requested here in Capital Health. And that's not only just in Halifax. On the website, which I checked, I believe it was yesterday or the day before, it was 280 days for, or it was 280 days in Capital. It was 300 maybe a month ago. Bridgewater is a little less, but it's still well over 100 days. So in the news release from Teresa Foley, she had indicated on the bottom that a new full field digital mammography machine is expected to be located at the new Cobequid Community Health Center. So I'd just like the this spring. And it said it should help reduce the wait times for these tests. So I'm just asking the Minister if that's correct, and when, or can you give a timeline on when that piece of device will be located and up and running at the Cobbett Community Health Centre?
The Honourable Minister of Health.
Thank you very much, Mr. Chair, and I'm very glad to that the member opposite, the member for Sackville-Cobequid, has brought this issue forward. You know, there's a couple of things that we're doing for mammography in this province. One is setting up the site in Antigonish. I think it's just ongoing at this point. So people in the Antigonish area can be served closer to home. That will, of course, take burden off of the nearest mammography units, which I think is in Glasgow, I believe. So that will, you know, take a little bit of loads off of the systems around it. The other thing, of course, is going on, and the member is quite right in the digital mammography issue, is that we are purchasing 2 digital mammography units for the province. One of them will be located, I believe, at the Cobequid Health Centre. As far as I understand at this point, that has been ordered. So we're just waiting for the delivery of the unit. Of course, the Cobequid Health Centre, being a brand new centre, has the space available and ready to go. So all we really have to do is receive the unit, get it set up in the facility where it's designated to go, and then start seeing patients. The other thing about digital mammography, which is a really good step forward on this one, is that there's a lot less time required with the unit, where the patient would come in, get the scan. Because it's digitally taken, the radiologist can see those almost immediately. So there's no developing time required on this one. And through our new PAC system, that a number of different radiologists can now see those and continue to go through them at a quicker pace. So not only are we increasing the scan time, we're also increasing the amount of time required to review those scans by the radiologist. So it will greatly improve the amount of people that can go through that system. And what we hope to do is over the next number of years is continue to invest in digital mammography, get those replacement of those systems in order to better see and better serve that'll see, of course, more patients. The other issue is that this will also lead to less invasive surgery, because of course we'll be getting it a lot sooner, or at least would be seen a lot sooner. The other issue that will happen as well, or the other issue that's happening sort of in tandem all at the same time, is that Nova Scotia has the highest retention rate for females to get this screening done. So there's like, I forget the number, there's like a 46% of people, or I forget, 38%, I think 38% of females are receiving the service now, which is at the highest rate anywhere in Canada. So I think it's kudos to the physicians and of course for our population of knowing the importance of getting a mammogram. But it also creates a bit of a problem on the other side, making sure that we have the system available to respond to that need.
The Honourable Member for Sackville-Cobequid.
So I hope I understand the Minister's answer was that you're waiting for that piece of equipment to come in, and that there shouldn't be very much delay on putting that in place, and hopefully by the time we get here in the next session, if the budget passes, that I can maybe stand and say that is going on. So I thank you for that. The other thing is, the Cobequid Community Health Centre is a great facility. I know the minister has been there. I know the deputy minister has been there, and many government members. It's a great facility. It services not only the people in Capital Health, but it has broad arms on who they see there, and it's kind of a great location because it can house or can help address some of the issues from down the valley, down near Truro and play an important role. And I think it's important to recognize that facility and the need possibly in the future to have many more facilities like the Cobequid Community Health Centre across this province. I think it will bring services to rural communities that they need in a timely manner, and I think it's a great model. But with all the, and there has been delays with the Cobequid Centre leading up to the building of the new facility, there has been a lot of talk around the services that are going to be delivered there. One, as I mentioned, was the mammography machine for mammograms, but another one is cancer treatment. It's been in a lot of the literatures. The facility itself is promoting the fact that that is coming to the facility. So, and I believe it's in the way of chemotherapy and chemotherapy treatment, so that individuals farther out from the capital here don't have to come in as often to the cancer treatment center or the Dixon Center. So do you have a timeline or any indications? I know recently the minister has been making announcements for satellite offices for cancer care and other treatments across the province. So is there any indication on when that service will be provided at the Cobequid Community Health Centre?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair, and again to the member of Sackville Cobequid. The issue, and I think the great thing about digital mammography, just to finish off that thought, is that the new machines can actually see, or it can double the capacity, so they can actually see twice as many patients through those systems. So, so we hope to roll that out right across the system over the next number of years, and of course would drop our wait times down dramatically. The services for Cobequid Health Centre, has sort of been a work in progress as we just recently opened that wonderful facility, with some great fanfare as well. Of course, that facility is designed to be a health center, providing some basic health services to the Bedford and surrounding areas. It is not, I guess, qualified as being a full service hospital, so we need to look at those services that best fit into that kind of health center. We are continuing to look at some further diagnostics that would be available at that facility. I'm not too sure on what the plans are for cancer treatment there, but I would probably suggest that there might be an opportunity over the next number of years to have cancer drugs administered there, so they can actually go in to receive their treatments for medical oncology. But we do, as we rolled out on Wednesday, the satellite programming for cancer treatment looked at a bunch of different areas and looking at the kind of services that were being provided. And of course, we took some of the experts in the systems and then looked from a population standpoint of where the prevalence of cancer is, looking at the services that are being offered at this time. So of course we've seen some improvements on some existing sites, the expansion of course for Inverness and Kentville. So at this point there is no plan from that particular investment for the Cobequid Health Centre, but we will continue to expand the services there for all residents of the Bedford and Sackville and of course all that area.
The Honourable Member for Sackville Cobequid.
And of course, I'm disappointed in that answer, but I anticipated that because there hasn't been much in announcements or inquiries or information from government around that. And I think, as I said before, we need to ensure that a facility like this, where taxpayers have spent hundreds of millions of dollars setting up this facility and having it manned by professionals, that we continue to look at other ways and other services that provides. And I'm sure that'll come another day when I'll criticize your government on that decision or that choice that you have. So now I'd like to turn to another area which is definitely dear to me and maybe the chair of the committee right now, around LifeFlight. And we all know that there's been issues around that service, not the service that Nova Scotians receive from it, but issues around the management and the running of the service itself. We know that there was a report, a consultant firm that was given given the okay to government to review Life Flight and the services that they had, and that there was 29 recommendations. And I believe in a news release from the minister himself that you stated that you would take, and I believe it's the Zalars report, back to Cabinet to look at the recommendations. So I'm wondering if the minister could inform us of that process, and if he has taken those recommendations to Cabinet, and what was the result of that meeting.
The Honourable Government House Leader.
Thank you, Mr. Chairman. I'd like the indulgence of the House to make an introduction today. In the, I guess it's East Gallery, we have today a visitor with us, Ms. Courtney Langell, who is a grade 5 student in Bridgewater Elementary School. And Courtney is visiting the House today with her mother, Kim Langell, who is my executive assistant, and of course Courtney's father is Andrew Langell. And I also wanted to say that Courtney and the other students in the grade 5 immersion class at Bridgewater Elementary were here in Halifax today visiting the Discovery Centre, and actually over at the Provincial Building with the Nova Scotia Museum and the Nova Scotia Art Gallery with respect to an Egyptian exhibit. And Courtney's class won the first prize for the province in a science project that they did on peanut allergies. Courtney was the narrator, among other things, on that project. I'd like Courtney to rise and get the greetings of the House.
Welcome. The Honourable the Minister of Health.
Thank you very much, Mr. Chair, and I too welcome Courtney to the legislature and to see the debate there. And I can attest that they've probably had a really good time visiting the exhibit over at the Art Gallery of Nova Scotia, seeing the Egyptian display. I really enjoyed it as well, and I know that my two children loved it as well. And really, for me, for the 4-year-old, he actually talked about it afterwards. So I knew, even though he was running around, he actually was paying attention. So it's a good surprise that my little guy Alec actually paid attention to his visit to that art gallery as well. Going back to of course the questions of the member for Halifax Cobequid, I can tell you probably Sackville Cobequid. I can tell you it'd probably be maybe some more fun to talk about the art gallery or something too. Well, you are a Metro seat, aren't you? Ultimately, the EHS Life Flight, Fitch and Associates came in and helped us in principle to provide us with some recommendations on the improvement of Life Flight, and to go back at the issue really that is before us with Life Flight. There has been some disagreements between some of the members of the Life Flight crews, being supported, of course, by their union and management of Life Flight. And really, it is a very, because of the model it uses, there is some very difficult relationships, because certain people belong to certain groups, where some of the workers belong to the union and belong to the QE2 site. The management, of course, belongs to Canadian Helicopters, and some of that management belongs to the EHS system, and some of the, so people are from everywhere, it seems, that offer this wonderful service to Nova Scotians. The one thing I do want to make clear is that the Life Flight system is still probably one of the best air ambulance systems in the country, if not in North America, which was substantiated, of course, by Fitch and Associates. But what they did recommend to us, and we have in principle accepted all their recommendations, pending, of course, a couple of budget decisions and some of the things that we see here today. One of the main recommendations that has been brought forward to us is developing a model where basically everyone works together. I don't know whether they all work for one unit, whether it's a contract from an operator, or whether it is a contract from the District Health Authority or what have you. But to basically have one set of managers that work with the one set of employees, so that there can be better flow of information and better flow knowledge and much better teamwork happening to ensure the safety of the patients on all flights. The other thing I do want to say about this Life Flight program is this Life program, of course, is under the direction of medical directors, 2 medical directors, of course, one through QE2, Dr. Petrie, and one from the IWK, Dr. Soder. And these 2 individuals provide what I believe is probably some of the best advice and best oversight of any physicians that we've come across in any system across North America as well. So there are a couple of steps that we have to move forward with, and we're hoping to do those, of course, in the next number of weeks.
The honourable member for Sackville-Cobequid.
And I think what the minister has stated is exactly why I think a review was done at a cost of $98,000. So, you know, there was an issue there. Government reacted to it, had a consultant go in. You know, in principle, you know, I hope that means you will implement the recommendations. But I'd like to quote in one of the news releases that was from, I believe it was from Christine Zallar, who was the consultant who actually did the report. And the title was "Single Boss Recommended for Air Ambulance System," which I believe is one of the recommendations. And in it, she says there are too many bosses. And I think that's what I've been hearing from all the different crews and the aspects of Life Flight, is that that is why there's an issue. That is why there's a big issue between those healthcare providers that are providing the service and the management. And I know that there's been several recommendations and talks within the interest groups that are involved in this. And one of them, I believe, is that Capital Health should or may or could take over the management of it. So with that recommendation and the emphasis around that there's too many bosses, which I think and truly believe that that's what's leading to a lot of the disconnect between the professionals that are working and the management and the running of the system as a whole. So is that something you're looking at, and maybe a bit more of a timeline on when those recommendations or when you will act on those recommendations?
The Honourable the Minister of Health.
Okay. Thank you very much, Mr. Chair. And out of the, like I said, out of those 29 recommendations, probably the biggest issue that is underlined is exactly as the member opposite brings up, that there basically is too many managers, and I sort of underlined why. It's because we have, of course, the contract for the helicopter, which is Canadian Helicopters. We have the adult crew, which basically works out of the site. We have some specialty group that comes out of the QE2. We have the pediatrics group, which comes out of the IWK, all fitting under medical oversight by our 2 medical directors. So you understand there seems to be a lot of chiefs there in order to run this program. And what we want to do over the next couple of weeks, and what I'm hoping, I know there's been an RFP proposed. We've had an opportunity to sit down with management. We've had an opportunity to sit down with union and those employees to look at what's best, and we have to make our decision. And what we think we're going to do is put that out to an open and transparent RFP where one individual, whether that be a company or whether that be district health authority, what have you, will bid on that contract to provide the Life Flight service. We will still maintain all the good things that we have in the system, which of course is medical oversight, and of course the employees, the actual flight nurses, the flight paramedics, and those people, because they are of course the core of why this system works so well. But you know, we need to have a better management structure there, and there has to be some clearer directives of who's boss. I think that's probably another big part of it as well. So I'm hoping that you know, I know that the RFP has been prepared, and what we'll try to do is have that out over the next number of weeks in order to have a clearer direction for all employees and of course for all Nova Scotians in regards to Life Flight.
The Honourable Member for Sackville-Cobequid.
And I would agree with the minister that the core of the service and the excellent service that we have is because of those individuals, the men and women who work to provide the service and the care for Nova Scotia across the province. And even though we have a small province and population, they play an important role because of how stretched out our province is. And it's amazing the timeline that this service can get the critically ill to the tertiary care hospital, especially here in Halifax, or more importantly, I think, is some of the children who are injured in a lot of our rural communities. So it's important that we recognize that we have one of the best services in the country, I think, or in North America, that we address this issue. Even with this issue going on, we still have the best. So it's important that we that you look at that and implement those recommendations as quick as you can. So I'd like to kind of a mishmash of questions on a few things before I get into some questions around long-term care. And one of them, recently we asked you in the House last week, I believe, around the ambulance fee report that was commissioned by your government, I think over a year ago, or more than that. You had it for more than a year. We know that your government is going to increase taxes, as we would call it. You might not call it increase in taxes, but an increase in user fees. And one of the things I've seen over the years is the user fee for ambulance, the ambulance service here in the province. I know that the chairman would agree with me when I was first trained as a paramedic. I believe the user fee was $40 to $50. $40 to $50, and the chairman said when he trained me, which I'll correct is true, he was one of my preceptors, but I believe the user fee was $40, maybe $50, and that was a short 10, 11 years ago. We currently see it at $150. And in the report that we've seen, which we had to go through Freedom of Information to get, the recommendations there is to set it at, I believe, $230. So we know the fees are going up, user fees in this province are going up. So I'm wondering if the Minister of Health could tell us today what the ambulance user fee will be when they make the decision to increase that fee.
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And this has been a long process, I guess is what you probably could call it, as looking at the recommendations. Of course, for the member for Halifax Fairview has brought this issue to the floor of the legislature on many occasions. And basically what we had is that a part of the recommendations that are held within the report talk about, of course, what we would qualify as hardship cases, or those people that are unable to pay for the transfers from hospital to hospital, or scene to hospital, house to hospital, and those kinds of things. And what I wanted to do is prior to the release of the report, is have the funding available within my budget to take on the extra billing that we would be taking on and covering the cost for what we qualify, again, these hardship cases. If you notice in the budget, there is $432,000 put aside to help low-income Nova Scotians get the service so that they wouldn't have to pay for it, or for those options where they cannot pay for it. The other thing that was going on at the same time is we're talking about the actual fee for transfer, which is was $120. We're looking at, because of the fee increases across the board that we're doing, is bringing that fee up to $128.16. That 6.8% increase that we're doing to the majority of our fees across the province. And Mr. Chair, that is still a far cry from the total costs of transfers of patients. The average number or cost of ground transport through our AHS system, through EMC, is $836 per patient. So we are asking for some cost recovery on this one. But in order for that report to come out, I wanted to make sure that, of course, this number was correct, because we had been talking about it for some time, and wanted to make sure that we had the funds available to take on that low-income piece that the member for Halifax Fairview speaks about on regular occasion.
The Honourable Member for Sackville-Cobequid.
Yes, it's been a passion of his, and I know he's brought the issue and fought for many Nova Scotians, because right now, currently, EMC, which runs the ambulance service in the province, is unable, from what we know, to just wipe out an ambulance bill. So it takes someone in the legislature or someone to get in touch with your office or the government to erase that. So if I understood right, you said $128 to an increase to $128 for user fee? Okay, and I'm sure we'll have questions on that at a later date. So quickly, I'd like to turn to now another issue that I've brought up, I know, in the legislature quite often, and that's around the issue and the problem of Legionella at the Victoria General Hospital. I know that there was a pilot program, or whatever the terminology is, to address that issue, that they are trying to address the issue of Legionella disease at the VG site. So I'd like to maybe ask the Minister of when will we get a kind of a comprehensive update or report on that issue at the VG hospital, and has it improved, or is it still remains the same on the quality of the water at the VG site or at the VG hospital?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, that is a study that is ongoing. If you remember what exactly the proposal was, is that there was a couple of sort of, the jury was out on exactly what we could do to that water system to address the issue of Legionella. Now, Legionella is of course a bacterium that can be found in many municipal water systems. And there had been some success in some jurisdictions on treating the water with chloramines. And the chloramines would be injected into the water, would kill the Legionella. But the problem was that it did not address the other issues of, and I forget the other bacteria that can be present in water that creates the Walkerton trial stuff. It's funny how I can come up with one word and I can't come up with another. But anyway, there are of course other bacteriums that are in the water that the chloramines did not address. So they were trying to figure out what kind of concentration or how you could treat the water, sometimes with chloramine and sometimes with chlorine, in order to address the whole issue, so you could actually have safe, completely safe drinking water. And you know, this study was I think a little late getting started. I think we were looking at a projected start date of somewhere in the beginning of January. Apparently there might have been some problems in getting the equipment that was necessary. The lucky part of this project at this point, which is lucky for this project, but it actually kind of concerns me a little bit on the other side, is that there is one water source for the full VG site. So there's basically one pipe that serves that whole campus. So it was relatively easy for us to adapt that system for the injection of chloramines and chlorine at the head. The concern, of course, that gives me is that gives us one entrance for a water system. So should something happen on that main pipe, we would have some difficulty in providing water to that campus. So there's a couple of things that, you know, keep coming to light as you investigate in further, that some other things that come up that you know, we have to address probably in the future. The information that I have right now is that study is ongoing, and we haven't heard you know, any of the results yet. I think it was a 6-month trial, and then take that data and basically testing at different sites throughout the hospital to see if there would be any appearance of Legionella. The issue of Legionella is not necessarily the ingestion of it as water; it's the breathing in of that bacterium, where if you were in a shower or you're in somewhere where the water is being oxidized, for lack of a better word, that you would ingest it into your respiratory system, and then it would affect you at that point. There is still currently ongoing on the cancer floor in the Centennial Building a bottled water policy, where the water itself is being brought in through bottles. There is no shower there at this point. But the other thing that we need to remember is that really the suggestion is for those cancer patients with immunodeficiency syndromes, because of their treatments, really are asked to stay away from showers and those types of things anyway, because the oxidation of water. So, you know, that can be apparent, of course, in any water system here in the city of Halifax, or of course anywhere in the province.
The Honourable Member for Sackville-Cobequid.
And I hope when those results come forward that, you know, you're prepared to try to act on that, if it's a positive or a negative reaction. Because the sad part about it is that we do have patients who are there who are fighting a disease like cancer, and I'm sure you're aware, I know I am, of the complications of that, and the, you know, of the people feeling sick, and, you know, the need to maybe have a shower. It's important, and I hope that that with this report that we can take some firm steps to address the issue. And if it means replacing the whole system, it means replacing the whole system. We're going to have to make that choice. Government's going to have to make that choice. And I know there's been issues around what we're using there now and other initiatives or other ways of dealing with ionization and all that. So I will keep. Is that what you're looking for? Ionization units, yeah. So I'll keep requiring the government to ensure that the patients that are there being treated at that hospital, have the proper water system. So now I'd like to go, and I know the member from Glace Bay mentioned it, I believe, yesterday, quickly around the Heart and Stroke Foundation. And it was my understanding, and I think the member from Glace Bay's understanding, that the foundation was looking at an increase this year in the budget for $1 million to improve programs and initiatives through the Heart and Stroke Foundation, through the programs that they give. So was that something that you're aware of? Was that they were in need or were requiring, or may have been indicated by government to them that they would receive $1 million in this year's budget to provide services for Nova Scotians?
The Honourable Minister of Health.
Thank you very much, Mr. Chair. And just to finish off the issue of Legionella within the VG site, within the Centennial Building, which will be a challenge. Even if we find that the chloramine or the actual water treatment doesn't work, we have to look at a couple of other mitigation strategies, which I know are ongoing at this point, which probably would mean the moving of some of those patients to another site where. Hopefully the water there would be better. But the total issue, again, looking at the facilities that we have in HRM, which really concerns me, of course, which is VG site, of what we do with that facility going into the future. So we really have to have a better idea of the structure as it stands today, what kind of shape is it in, what kind of things can we do to it tomorrow to ensure that it continues to serve patients as a tertiary care unit. And should that not be able to happen, what would be the strategy for replacement of that facility in the long term as well. So there's a number of challenges that this represents to us, because we can't necessarily just replace a water system. As much as we would like to be able to think that we can go and pull the pipes out and put new pipes in, that Legionella still exists within the system, somewhere between here and the Pockwalk water system, and it can be anywhere into it. So there's no way to really stop some of these things from happening. And by removing pipes, you really don't know where it is, because I'm sure there's miles and miles and miles of pipe within that huge facility. When it comes to the heart and stroke or the stroke strategy, which the member for Glace Bay brought up yesterday, and I thank the member for Sackville-Cobequid for bringing that up again. There still is a contribution of $500,000 to continue the development of that stroke strategy and the implementation of that stroke strategy. And the current provincially led work includes development of a stroke acute care guidelines, environmental scan for stroke rehabilitation, development of post-acute stroke rehabilitation and community reintegration guidelines, a provincial stroke audit, and a provincial professional education needs assessment. So a lot of this is still ongoing, and this here is one of those. I'm pretty sure that the Heart and Stroke Foundation and those partners felt that they required $1 million to do that this year. From further look at it, and we felt that an investment of $500,000 was adequate to keep the program going and continue the work and the good work that it's doing for all stroke patients in the province.
The Honourable Member for Sackville-Cobequid with just over 2 minutes.
And I think that leads me into my comments, is that somewheres the Heart and Stroke Foundation had some kind of indication that they could proceed and expand the programs that they deliver. And I've said it before, and it's so important that government invest in those programs that hopefully will reduce, I think, is the objective of what everybody wants and what government should want, but what would reduce the healthcare costs in the future. And I think the programs that the Heart and Stroke Foundation, especially around prevention of strokes and the indicators and treatment and programs early on before an individual Nova Scotian has a stroke, puts such a great burden on the system, the healthcare system, that's what they were looking at. So I don't know where the miscommunications, but I know that the foundation was hoping for better news. I know the minister said that $500,000 is in this year's budget, which was in last year's budget, but they were looking for and hoping for additional funding. And, as I said before, programs like which the Heart and Stroke Foundation gives and promotes is important, just like programs around diabetes and ensuring patients with diabetes in this province have the medication and the access to care early on, so that the complications from diabetes don't happen. It don't incur an increased cost in healthcare in this province, and that's why it's important, Mr. Speaker or Mr. Chairman, and important to government to do that. So I don't know if it came from your department or you, Mr. Minister, but did you give any indication to the Heart and Stroke Foundation that there would be a possibility of $1 million or more in this year's budget for programs?
The Honourable, the Minister of Health.
Thank you very much. And no, we in the department, nor I myself, gave any indication that we would be funding that to $1 million. Again, $500,000 we felt was adequate to support the program and continue the good work they do. But it really brings up the issue of, there are many programs that come to us, people with proposals, and all of them are geared towards making patient outcomes better, helping Nova Scotians. The best example is on one day I met with the Palliative Care Association of Nova Scotia, I met with the Osteoarthritis Association of Nova Scotia, as well as in heart and stroke. So at the same time, they all have multi-million-dollar proposals in order to help Nova Scotians, and we have to find that balance between the resources that we do have available and funding those programs as best as we possibly can. And it's good to go forward with a lot of these programs as well. So with that, I want to thank the member opposite for his hour of questioning.
Order. The time has expired. We'll now recognize the Honourable Member for Glace Bay.
Thank you, Mr. Chair. Mr. Minister and staff, welcome back to the greatest time of your lives and estimates, I'm sure. The other day, during discussion, we went into some general discussions on many aspects of health care, and today, if I may, during the next time allotted to me, I'd like to go through some line-by-line items, if we could. So just to prepare you to get your sheets out there, because that's what we'll be dealing with. Starting on page 13.3 of the supplementary detail. And under acute care, addiction services, public health, and mental health services, all are seeing an increase in funding. So my question is why? And are those new funds going to administration and salaries, or are they going to additional or expanded programs?
The Honourable, the Minister of Health.
Thank you very much, Mr. Chair, and I will probably do my best impression of a radio announcer, wasting a little bit of time until we can find page 13.3 within the documentations that we have, so that I can address it correctly. I know that it's my best impression. I know that my CFO here, Alan Horsberg, has done a phenomenal job of putting together his book, and I'm sure he'll get used to it as the number of hours continue to go throughout this debate. So, page 13.3, I believe, is what the member opposite has brought forward. There you go. And we're talking about the increase in care coordination, home care services, and long-term care. So your third, which book are you in? Supplementary detail. There you go. Do we have supplementary detail? We don't have that. All right, I'm trying to draw time here and it's not working. I tell you that member for Timberley Prospect looks some good there with those sunglasses in here. I tell you, life's so bright. His life's so bright, he's got to wear shades. We're going to have to get that document for you. We actually don't have that with us. I apologize to the member for Halifax or to Cape Breton, Glace Bay.
Honourable Member Glace Bay.
Well, Mr. Chair, would you like a moment? Because most of the, perhaps, Mr. Chair, if we could then, if you wanted to take a couple of minutes recess, that's fine by me to straighten things out.
Honourable Minister of Health.
I think we would appreciate just maybe so we're clear of what we're talking about through this discussion. Again, I apologize to the member for Glace Bay.
Okay. Recess then for over 5 minutes. Okay. Glace Bay.
Thank you, Mr. Chair. So I don't know if the minister wants me to repeat that question or just want to take it from where we left off would be fine.
Honourable Minister of Health.